Support for the Idaho Matters podcast is brought to you in part by University of Idaho, Idaho's only Carnegie R1 classified research university. Our Carnegie R1 designation recognizes the discoveries we make that help our forests thrive. It means we're creating more doctors and doing real research to strengthen cybersecurity for Idaho businesses, our energy sector, and every Idahoan. More at go.uidaho.edu/Idaho-is-Idaho.
Laws are being drafted and debated at the State House right now. Laws that will likely affect your everyday life as an Idahoan. The Connector helps you keep up with the legislative session with clear reporting, local context, and explanations that make it all make sense. Stay connected to the State House with the Connector, Idaho Daily News. Listen wherever you get your podcasts.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. You're listening to Idaho Matters. Well, Influenza B, it is hitting Idaho and the Treasure Valley, and it is hitting children and teens the hardest. In fact, many schools in the area confirm about a 20 to 30% of its student population have actually been out of school this week because of the flu. And according to the CDC, 52 children have already died from the flu this season, 2 right here in Idaho. And 9 out of 10, according to the CDC, had not gotten a flu shot. And health experts say they're worried the worst may still be ahead of us. It's Wednesday, which means Dr. David Pate is joining us, of course, to talk about all things public health. And remember, if you have a public health question, send us an email at idahomatters@boisestate.edu. Hi, Dr. Pate.
Hi, Gemma.
Okay, Dr. Pate, I have to say, I literally got an email right before we went live on the air. My youngest son's school is closed tomorrow. More than 30% of the student population is out sick. Both of my children are down with influenza B, as you know, Dr. Pate, because you and I have been texting about it all week and the proper precautions to be taking. My children did get their flu shot. They've still gotten the flu. The CDC reports that as of January 30th, the United States has seen at least 20 million cases of the flu. More than 270,000 people have been hospitalized. We already mentioned how many people have unfortunately died from this. So my question to begin this conversation is, what is standing out the most to you about this flu season compared with recent years, in particular with children? Because, as I said, both my children have influenza B. They got their flu shots in November. My husband and I got our flu shots in November. Knock on wood, we're fine.
Right. So what stands out to me is that, first of all, it is not uncommon for influenza B to lag behind influenza A. In other words, when we see the onset of flu season, generally it is the A strain that predominates and does so for months. Then what can happen is B comes just as A has peaked and has started to make its way down. Now B will circulate. B tends to affect children much more than even the A strain, predominantly relative to older people. So this is not particularly unusual. Some years, and it's too early to tell, but certainly what I'm hearing from talking to some of our pediatricians and what they're seeing in terms of the B activity, because like you said, it's gotten so bad that, there's at least one school closing. There maybe have to be some others closing, but what remains to be seen is, will we have a second peak in influenza? Because we already achieved our peak and we're coming down. In many years, it will keep coming on down. On the other hand, it's not uncommon that we will get a second peak, and certainly can be from the influenza B. I think the things that strike me about this year, first of all, as you remember, you and I were warning listeners that there were reasons to believe this would be a bad flu season. It's certainly what we observed looking at Australia that gets their flu season before us, looking at some countries like China, Japan, some others. Those countries had to mass close schools in order to stop the transmission. Influenza epidemics are always driven by school children bringing it home, and so. But what I warned about this year is, number one, that we were seeing particularly severe flu seasons in other countries that get their flu season before us. Number two is that we were seeing an H3 virus predominate in those other countries. And we don't usually have that happen. We typically have H1 viruses predominating. What does that? What's the implication of that? The implication of it is that for many people, they may have gone years before seeing a virus like this. And if they're young children, they may never have seen a virus like this, meaning that they may not have, without a flu shot, they may not have any kind of immune protection against that virus. And that's why what we've seen when the CDC has broken it down and compared the severity of flu for children up to age 17 versus young adults 18 to 64 versus old people like me over 65, what they've seen is it's the children 0 to 17 who have had the most severe infections, and probably because they have not likely been exposed to this virus. The other thing that we warned your listeners about is that over the summer, the virus went through at least 7 significant mutations, which meant that because we here in the United States seem to not like mRNA vaccines, which are the only ones that we can turn those vaccines over in a very short period of time and change the Constitution. But, people have gotten themselves all worked up about mRNA vaccines. So currently our government doesn't find those in favor. The problem is the other technology that we use, it takes many months to get those vaccines ready. So we had no option to change our flu vaccine, which meant we knew it wasn't going to be a great match. Now, with that said, that's why we do see, like your children, they can get vaccinated, they can still get infected with the flu virus because it's not as good a match as we would like. However, the good news about getting your kids vaccinated is they're not going to add to that number of 52 deaths in children that we've already had. It is very unusual that we have somebody die of influenza who has been previously vaccinated. And so, this is so sad that already we've got 52 children that were here last year that aren't here this year. And it's just hard to believe. And we have to always remember those numbers lag. We typically don't get deaths reported for quite some time. So those numbers will continue to go up, no doubt. But the vaccine is highly protective against severe disease, even with the mismatch.
So the CDC is actually reporting as well that this is the highest pediatric flu hospitalization rate in 15 years. They also have reported that nearly 90% of the children who died this season were unvaccinated. And so from a public health perspective, Dr. Pate, truly how significant is that number?
Well, it's very significant because we have to put things into context. Let's look at what's happening right now. We are having the highest levels of measles that this country's had in something like 30 years. Where we used to protect children, now we have decided, let's let them fight all this stuff off on their own. So we're exposing them to measles. We had data last year to show that even though children in general face lower threats of severe disease and mortality for COVID than adults. Data showed that if those children were vaccinated, they had benefit at every single age. And yet our government said, let's remove the recommendation for COVID vaccines. And we've now had our Secretary of Health and Human Services saying, your kids will be worse off if you give them the flu vaccine, which is absolutely false. And so what we're seeing is that we are moving backwards to a time when, in general, we are providing our children with less and less protection. And we're seeing what's happening. You can look, we're on the brink of losing our measles elimination status. And so we've got children dying of measles that would never have died before. We've got children dying of flu that likely could be prevented, and we could prevent quite a few of those hospitalizations. And yet we are bombarding these children with all these viruses that we could otherwise protect. And then what's going to happen is this is at a time when our knowledge of the consequences of getting these infections, these do not build your immune system. We are starting to put the pieces together to be able to explain the links between these infections and subsequent health problems.
Mm-hmm. So, Dr. Pate, as we know, vaccination rates among children have dropped sharply since before the pandemic. And then, of course, as you mentioned, the federal guidance around the routine flu vaccination for children recently changed. I'm wondering what you think are making parents increasingly opt out of certain vaccinations, in particular the flu shot. And I will say this: I can guarantee that there is probably someone listening who is thinking, well, her kids got the flu shot, and see, they still got the flu. So see and that's that is an argument, right? Well, you get them vaccinated, they still get it. I will tell you this from my own personal experience over the weekend is that my youngest child, I mean, yeah, he was feeling crummy. It was not so significant that my, mom flags went up. It was really Saturday night that I was like, I wonder if he's got the flu. And it was basically because this child just wasn't super sassy and just his typical talk backing self that made me start to think that maybe he had the flu, but he wasn't that sick. I have had the flu when I was not vaccinated in my 20s. It is the worst I have ever felt in my entire life. So do you think that part of that is because of this, that we are being told by certain health officials over the last 6 years that vaccines don't keep you from getting sick?
Yeah, I think that there are many reasons that people decide not to get the flu shot. One is unless you've had influenza, you really don't understand how bad it can be. And unfortunately, we tend to throw the word flu around a lot, so that a lot of times when people just have regular old colds, they'll say, I've got the flu. No, flu's quite different. And so what we see is when people do end up getting infected with the flu, the influenza virus, they are surprised how much worse it is. I'm like you. Even being a doctor, I've only had influenza twice in my life. And that's because I get a flu shot every year. And it's not perfect. And so if your expectation is that you get a flu shot, that means you're not going to get influenza. Well, you're going to be just disappointed at times because it's not, that virus changes so much. It's not perfect match. But what it does keep you from doing is getting very sick, ending up in the hospital. I've had a child in a hospital for other reasons, and I can't imagine that any parent really wants their child to be in a hospital. Even avoiding that would be worth getting the flu shot. But then there's the addition of, and we talked about these 52 deaths of children. I can just about guarantee you at least half of those parents would say they would have no idea that their kid could have died from influenza. I remember my wife Lynette had a classmate that in her 50s got influenza and then died. She was healthy, but not from the influenza virus, because then she got a secondary bacterial infection and it killed her. And that happens a lot. And so, one is that people don't understand how bad the flu can be. Two is they don't understand the reasons we vaccinate. And of course, government officials take advantage of that, and some of the doctors that spread disinformation to say, hey, look, see, it doesn't prevent you from getting infections, so it's not really a vaccine. It doesn't work. Well, no, that is not true at all. And then the third thing is that sometimes, because we'll see the flu shot start being distributed to pharmacies in as early as July or August, and they put out their signs and say, "Come get your flu shot." If you get your flu shot that early, it is the protection you're going to get from it is going to wane by the time we're seeing the peak to the tail end of the flu season. That's why you and I told your listeners every show last year, wait till we give you the sign. Let's time getting our vaccine so that we'll have the best protection for the longest period of time. And so those are all reasons involved. But I think part of it is just that people are also thinking, they're dismissive of the flu. What if my kid gets the flu? Well, we've seen what can happen. They can end up at the hospital. Some children, and you may not be able to predict it, can die. And then for adults, we have started seeing that there's good data that you remain at increased risk for heart attacks and strokes for months after it, because these virus infections that we can prevent with vaccines cause tremendous inflammation in your body. And so it may not be the virus itself, but the body's immune reaction to it that can then put us at risk for even months following it, let alone measles, which we've talked about, which actually wipes out part of your immune system for perhaps several years, making you those kids at increased risk for additional infections that the measles might not take their life, but those in other infections can.
And we wanted to play a listener voicemail right now in regards to vaccines. So let's take a listen.
Yes, this is Jim Gervin. I'm a former dean of the College of Health Sciences at Boise State University and a public health professor. And I just wanted to thank Dr. Pate for his honest evaluation and honest answers and study to the literature that's out there and the knowledge that we have about measles, polio, and other infectious diseases. He's entirely accurate in what he says. I have a short story. In 1956, when I was 10, I remember my mother coming back from the store. I'm the oldest of four. All four of us kids were there. And she had tears in her eyes. And as the oldest, I said, "Mom, what's wrong?" And she said, "Yes, guess what? Tomorrow we're going to get to go down, and each of you is going to get a shot, and I won't have to worry about you getting polio." That was a profound time in our family, and only my brother and I are old enough to remember it. My two sisters don't remember the shots or the incident, but my mom's no longer alive. But if she was here to this day, she would say, "Listen to Dr. Pate. He knows what he's talking about." Thank you very much.
And Dr. Pate, I think that just puts into perspective maybe what, fast forward generations, that some people just don't necessarily fully understand and appreciate, because vaccines have done what they were supposed to do.
Oh, yes. And boy, I sure appreciate him spending taking that time and sending in that message. That's very gratifying to hear. And he's telling an important part of history. I too was too young to remember, but I've talked with my mother who explained, you know, back then when the polio vaccine came out, just as he was saying, parents were elated. Parents were overwhelmed with joy and relief because they were so scared that their children would end up paralyzed, end up in iron lungs. They wouldn't let their kids go to the swimming pools during the summer because they were afraid they would get polio. And my mom was describing, people lining up blocks long to get the vaccine, and she'd say cars would drive by honking their horns, celebratory. And I said, Mom, do you remember any kind of anti-vaccine sentiment? Oh, don't take those; they're not well tested, or all that stuff. She said, not a bit of it. She said we considered it a triumph in this United States, and so it is sad to see that. Unfortunately, sometimes vaccines do become victims of their own success because while there are diseases that I'm old enough that I've seen and people older than me have seen even more, a lot of younger people today have never seen polio cases, have never seen diphtheria, have never seen a case of tetanus. And listen, all you have to do is see one case of tetanus, and you'll never question the value of getting that vaccine. But people haven't seen it, and they become complacent, and they think, why are we vaccinating our kids against a disease I've never heard of? Well, it's so that you will continue never to hear of it.
Mm-hmm. So, Dr. Pate, with just a couple of minutes left, as we've talked about, we have major medical groups that are continuing to recommend childhood vaccines, who are continuing to recommend annual flu vaccines for adults and for children. How then do parents navigate these conflicting messages that are coming from government officials and medical organizations, right? And now that there's this added layer of, you can't just go to the pharmacy and get your kiddo a flu shot, right? You now have to go talk to your pediatrician. And I know some people would say, well, that's what you should be doing. But for a lot of people, that just adds an extra layer of inconvenience, or even maybe a copay, or if they don't have insurance, a payment to the doctor that, they can't afford.
Yeah. No, I listen, I'm going to just speak heart to heart to your listeners. If you trust me, if you believe me, then please listen to this. And like Gemma has said before, I'm not getting paid. No one is paying me one penny to come on this show, to say anything. Nobody tells me what to say. On my blog, I don't receive one penny from that. I just tell you like it is. And I tell you like it is because I think there's a responsibility of those of us that have received privilege that we need to tell the truth. We need to stand up to lies. And so, parents, I want to tell you, I rarely talk like this, but things are getting so bad and they're going to get worse. But I want you to understand that we have people in the highest levels of government that are trying to manipulate you for their own personal purposes. It's rare, but we do have a few doctors who are spreading some disinformation because they are getting personal gain for it, and they really don't care what happens to your kids. So let me tell you, if you want to get good information, talk to your own doctor, talk to your pediatrician, talk to your family physician, talk to your internist. talk to your obstetrician, get good information there. If you want to know more, if you want to read more, go to websites of organizations that will tell you the truth. The American College of Pediatricians, the American College of Physicians, the American Association of Pediatrics, the American Society of Infectious Diseases. You can go to many of the state public health websites to get information. Our own vaccines for children, and there's many websites where you can get good information. Please, right now, don't take your vaccine information from our government. I'm afraid that we're just hearing a lot of nonsense.
Well, Dr. Pate, as always, we appreciate the scientific facts that you bring every week to this conversation. That is our responsibility as well, is to give out the facts. So as always, we so appreciate you. And remember, folks, if you have a public health question for Dr. Pate, send us an email, idahomatters@boisestate.edu. I'm Gemma Gaudette, and this is Idaho Matters.
Hi, it's Terry Gross, host of Fresh Air. Hey, take a break from the 24-hour news cycle with us and listen to long-form interviews with your favorite authors, actors, filmmakers, comedians, and musicians, the people making the art that nourishes us and speaks to our times. So listen to the Fresh Air podcast from NPR and WHYY.